Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Forspiro inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition with the risk of side effects, such as a sore throat or mouth infection. You should always sit upright or stand up when using your Forspiro inhaler. Hold the inhaler horizontally with the protective cap facing towards you. Open the protective cap downwards to reveal the mouthpiece and dose counter. To load a dose of medication, make sure the side chamber is closed. Prepare the dose by lifting the white lever fully until it clicks. You will see that the dose counter will go down. Only do this once so as not to waste any medication. Now close the white lever so that it clicks back into its original position. A dose is now loaded and ready to use. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Hold the inhaler level and place the mouthpiece into your mouth with the protective cap pointing downwards. The mouthpiece should be between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Make sure that you do not block the air vents with your fingers. Breathe in through your mouth steadily and deeply to inhale the full dose of medication. Remove the inhaler from your mouth while holding your breath for up to 10 seconds or for as long as is comfortable. Breathe out slowly, but not into the mouthpiece. Close the protective cap over the mouthpiece. As your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. As you use the inhaler, the side chamber gradually fills up with the used strip of foil. There should be 2 sections of foil strip in the side chamber at the end of every day. Removing these 2 pieces of foil every evening can help you monitor the use of your inhaler. To remove the foil strip, open the transparent side chamber door and carefully tear away the full length of foil strip against the teeth of the side chamber. Do not pull or tug on the strip. Once done, close the side chamber door and throw away the used strip. There is a counter on your inhaler next to the mouthpiece to show you how many doses you have remaining. When there are only 10 doses remaining, the numbers will appear on a red background. You should order a new inhaler from your GP at this time. To clean your inhaler, wipe the outside of the mouthpiece with a dry tissue or paper towel. Do not use water to clean your inhaler. If you're unsure about how to use your Forspiro or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.